Thank you. So I'm Suzanne Wilson. I'm the director of the Division of STD, HIV, Hepatitis, and Tuberculosis. I'm here at the Bureau for Public Health. Shannon McBee, our state epidemiologist, couldn't be with us today, and so I'm gonna fill those big shoes and lead and sort of facilitate the meeting today. So I'm glad everybody could join us. And I'll turn it over to Andrea for a few quick housekeeping updates.
Hey everyone, just to let everybody know, this meeting is being recorded, and as soon as it's over, I will post it to the DHHR's YouTube channel as soon as possible. I do ask that members of the public and media hold their questions at the very end, and if you need to get my attention, you have a question that you really want asked, you can feel free to send me a chat just to make sure that we see it. I can also drop our email in the chat box as well if you don't have that. That's all I have.
All right, thanks, Andrea. So I'll get started first with an epi update. Share my screen. I practiced. Let's see if we got that. If I got it right this time. Can you guys see the slides? Yeah. Okay. Great. Let's go. There we go. Okay. So the current outbreak data reflects an increase of 3 new HIV diagnoses from the last time we met in January, bringing the total for Kanawha County since the beginning of 2019 to 97. One of the new cases was diagnosed in the 4th quarter of 2021, and the other 2 were diagnosed in the 1st quarter of this year. Currently, 41 of the 53 cases that were identified in 2021 in Kanawha County have been confirmed to be associated with injection drug use. And just always, as we always remind everybody, these data represent residents of Kanawha County or individuals who were homeless in Kanawha County at the time of their diagnosis. So the overall epidemiology of the outbreak remains the same at this point. There's still slightly more male cases than female. 79% of the cases are between the ages of 20 and 40. 56% of cases report being unstably housed or homeless in the past 12 months, and 91% are co-infected with hepatitis C. Hospitals have remained the setting where the largest number of cases have been identified at 44%. However, over the last 2 months, the majority of new cases have been identified by outreach testing by the Ryan White program and West Virginia Health Right. So at the medical status, looking at the medical status of the cases, most categories continue moving in a positive direction. We saw a slight increase in the number of individuals linked to care within 30 days of their diagnosis, which is great. We want to get people into care as quickly as possible. And we also had an additional individual who was virally suppressed at their last test, which is also great news. That's our ultimate goal, is for people to achieve viral suppression and not be able to transmit the virus any longer. So just as a reminder, you can find statewide data by county on our HIV Aware West Virginia webpage, where there's a tab specifically with information related to Kanawha County. And also, as a reminder, as Shannon mentioned last month, we do have, as a part of our response activities, we do have training available through the Mid-Atlantic AIDS Educational and Training Center. There's a whole host of virtual trainings available on HIV, on different HIV topics and the link is available on our website and is also here on the slide. Okay. That was all I had for the EPI update. We can now move into some partner updates. Rhonda, I see you first, so you happen to be first in line on the screen, so I'll I'll start with you. Do you want to give an update from Health Right?
I don't know if that's good or bad, Suzanne. So I should say in January, we kind of had to pull our outreach team because we had a COVID surge. So we pulled our team and ended up doing over 10,000 COVID tests on site and had several staff as well out with COVID. So we were limited on what outreach we could do for HIV. The first week we were able to get out there and test some people. I think we tested 21 and we didn't have any that were positive. I'm happy to say that the outreach team is back on track this week and they're back out. And I hope and pray that we are on the decline of COVID because we saw our highest positivity in January ever here. It's a little scary. So I'm hoping that we see a light at the end of that tunnel.
Yes, for sure. For certain, I think we're all there with you on that. Okay, thank you. I guess Robbie, I see you next. Do you have any updates from the health department?
Hey, Suzanne. Just like our friends at Health Right, the COVID surge hit us pretty hard here and pulled back on some plans that we had to do some outreach in the western end of Kanawha County. We are still experiencing a few lingering staffing issues, but expect those to resolve themselves here soon. And we plan to get back on track with our outreach in the Rand area, bringing together all the partners we did before in London for complete HIV testing, COVID, and other treatment resources that we can get out to folks. So as soon as we get that back on track, I will get information to Tristan for the calendar and get everyone back together. Dr. Young has been working with several agencies around the injectable PrEP therapy, which would be easier than using the actual tablets, and also working around a platform so that there can be a repository of information should a patient not come back to the same agency for services next time. And additionally, we're continuing to use grant funding to support the naloxone training and QRT support with our partner agencies. I guess the big thing moving forward is for us to get back out in the field, hopefully sooner than later, with our next stop being in Rand.
All right, great, thank you. Cassie, I see you next. Do you have an update from Hopwa?
Oh yeah, we are waiting for everybody to get back out, so we're not by ourselves there. But me and Miss K both have been still doing outreach, still getting out. Haven't really tested many people just because of how cold it is outside, and they don't want to stand out there that long. So just really keeping the rapport up. I did get 3 of our cluster housed in the last month. It's very exciting news for me. One of them I've been working with the whole time I've been here, so it's been about 2.5 years, and the other 2 are a little newer. So, but getting some people's housed. The one that's housed is actually probably the one that was is non-detectable now. He's doing wonderful. So just can't wait to get back out there and start testing and doing what we're doing all summer long. Just COVID put us all down. And then, of course, I was out half of January with COVID. So, but February is looking pretty positive.
We're good. And yes, and let's all hope so. I don't see Christine is listed. Is anyone from Ron White on? No. Okay. I'll just give a quick program update. So we are currently working on, kind of as Rob mentioned, we're currently working on developing the schedule, a calendar for testing across the state for the upcoming spring and summer, and we'll continue to support the mobile testing on a weekly basis here in Kanawha County. We did also receive from Tina Ramirez sent a lot of information to Trista to update our testing calendar with a lot of other community testing that's going on through their organization and several others. So our calendar does have quite a bit more information on it now, and community testing that's available all across the valley. So that's pretty exciting if you've not had a chance to take a look at that. And I think that's all I have right away. We're currently working on just filling vacant positions as well, and trying to get trying to get staff trained and ready and available for response. I still somebody, oh no, that was somebody joined. I was just checking to make sure that wasn't Christine. No one from OFLAC was available to join us today, so we don't have an update from them at this point on, but it is our understanding that they have not they've not had any additional programs apply for licensing since last month. But if anybody else has any specific questions, we're happy to take those back to them and get a response. Are there any partners on there that I missed or that would like to give an update?
Suzanne, just a quick update from Kanawha County Emergency Ambulance Authority. We continue to partner and work with KCHD, but also kind of a unique piece, and COVID surge has delayed that outroll of the program, but we're going to incorporate QRT, the HIV testing with our QRT outreach as well. So that is forthcoming. Also, we've been working with the Mid-Atlantic AIDS Training Center, and they're going to be giving our first responders some updated HIV training, which will start next Monday on the 14th.
Great, thank you.
Thank you.
Does anybody else have any updates?
I don't, Suzanne, but I have a question for the group. I forgot to ask you guys earlier, but are pharmacists allowed to give or prescribe PrEP in their pharmacies? I heard on another call that there are some states that allow pharmacists to do that. Do you guys know or heard about that? Or has that been ever discussed in any previous calls?
It has not been discussed in any calls, and I don't know myself. I know they're allowed to vaccinate, but I'm not certain about that.
Someone wrote in.
Someone had, yeah, there we go.
Okay. All right, thanks.
Mm-hmm. Yeah, thank you, Amanda.
Suzanne, can I just check in on the grant, and have we hired the GIS person for Kanawha County yet?
So the positions, the new positions that we requested, including the new DIS for Kanawha County, they were approved at the end of last week. So we're beginning to move forward with the posting process this week.
Thank you.
Mhm. Right, does anyone else have any updates or before we move into questions? Okay, do we have any other questions that came in?
I see one question in the chat box from Katie asking, are STD clinics able to get PrEP at 340B rate or at a discount?
So I will, so STD clinics that are registered, so like local health departments who are registered and utilize state resources for testing and are registered as STD clinics with the state, they're able to, we provide their medication at 340B rate, but I'm not certain about private clinics. I will have to find out and get back to you.
Hey, Suzanne, this is Katie. I'm the one that asked that question. Is there any way that you can follow up with me at my email that I just posted in the chat about that?
I sure will. I see it there. Thank you.
Thanks, because our clinic is an STD, a registered STD clinic with the state of West Virginia.
Okay.
Thank you.
I think Brooke just came on from Ryan White.
Oh, okay. Brooke, are you there? Did you have an update from Ron White? Caught you just as you're coming on. You're muted if you're. No.
Suzanne, I don't know if this happened with others, but my chat box, I saw questions and then they disappeared. So I just want to make sure if there are questions that folks can see them in the chat, or feel free to raise your hand.
Yeah. Does anyone else have any other questions? No? Okay. Well, I appreciate everyone's time today, and we'll give you a half hour back in your day today. And thanks everyone, and stay safe. And we will, Katie, I will get an answer for you and follow up by email.
Thank you.
All right. Thanks everyone.